Hello, I'm here. Just checking in.
చెక్ అరే అక్కడ ఆఫ్ చేసినట్టున్నాడు అన్ని చెక్ మాట్లాడుతున్నారు అరే మాట్లాడుతున్నా హాయ్ సార్ am I audible?
Hello, this is John Board. Do you hear me now?
Sir, good afternoon. Check. Am I audible, sir?
Yes, I hear you. Yes, I hear you. Do you hear me? Hello, do you hear me? Perfect. Okay, thank you. So we start in 10 minutes, and until then I stop video and put myself on mute, and then, but I am standing by. So just call me.
Check, check. Hello. This is not on. Check. Check, 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 check. Check. Yeah, Dr. Samba, are you there?
I definitely am.
Yeah, okay. Yeah, Professor, we're giving you a co-host. And so let's welcome the afternoon session with virtual speaker, Dr. Samba Lagza from Hungary. And he will be speaking on lifelong exercise for healthy joints. We welcome you, sir.
Welcome.
And it's on to you. Kindly go ahead.
I'm sharing my slides. Do you see my slides? Do you see my slides?
Yeah, yes, sir. Yes, sir. It's visible.
Okay, perfect. Shall I start right away?
Yeah, you can go ahead.
Okay. So, hello, everybody. I have a title, Lifelong Exercise for Healthy Joints, but I gave this title when I was not aware of that there are fast new excitement is there for exercise medicine in Hungary. So I expanded the scope a little bit, and I will talk about the nationwide program for exercise medicine in Hungary. But first, a short introduction. I'm an orthopedic surgeon. I do quite a lot of research on blood serum therapies and regenerative medicine. And I am leading a sports medicine center at my university in Budapest, in Hungary. And I truly regret that I cannot make it in person to this meeting in Hyderabad. But as you can see, I found a picture of myself from 25 years ago when I was backpacking in India, and I still have really good memories of the country. Definitely plan to visit soon. So let's go a little bit deeper. Exercise prescription. This is the Hungarian experience so far. About 10 years ago, or even maybe more, my colleagues in Hungary joined the Exercises Medicine Consortium, which you all know was launched by the American Society for Sports Medicine. And then they held conferences, and then they even had talks at different other conferences, and even developed a program. And this program was adapted from the American program, and the idea was that exercise prescription should be supported. Do you hear me now? I am not frozen. I just don't have any feedback whether there are people who actually listen.
So I didn't get you, sir. Can you just repeat?
Has it started yet? Because I'm already doing my talk.
Yeah, we are all here, and okay, I'll give you the view of the audience also.
The audience is there.
Yeah. I'll give you the view of the audience.
Okay, because I see a bouquet of flowers. And
yeah, there are the audience.
Now it's much better. I understand. Okay, so it's a little bit more live than it was before. Thanks.
Okay.
So I can continue.
Yeah, just continue, sir.
Okay, so where was I? There was a program, and this program was a really nice one that exercise should be prescribed to patients of different diseases, and it should be supported from the national health budget. But there was no interest at all from the decision makers, really. And the main reason was that due to budget constraints and competition from pharma, and that's why we weren't really able to do anything besides having a program, having a couple of nice papers. So what has changed since then? The good news is that there is an active Hungary program, and then this is led by a state secretary. So in our country, there are very few ministers, So if you have a state secretary for a program, it means something. There is one state secretary for health. There is another state secretary for education. And now there is a state secretary for Active Hungary, which is really focusing on multiple leisure sports activities. For example, this government agency is helping ski slopes because there should be some winter activities for the people. Or they design tours in cities like in Budapest, what you see on the picture, how to be active by bike, by walking, even by rowing in Budapest. So there are quite a lot of sports activities around that. And as this state secretary usually says, that he is really the secretary for health, not like for active tourism only, because he is taking care of healthy people. And the state secretary for health is really taking care of only sick people. So this guy and then his team is really moving into the field of healthcare from the angle of active tourism and active lifestyle or healthy lifestyle. That was one thing. And the other one that has changed, that there were quite some grassroots efforts. And I just give you an example of only one, which is District 12 of Budapest, which is an affluent neighborhood. This is where our university is also located. And this district initiated a green prescription program. You can see that in Hungary, a normal drug or pharma prescription is pink. So they created a local green prescription as well. So this is a form. And then on this form, the GPs were able to prescribe sports activities and exercise to their patients. Now, unfortunately, only 4 out of the 12 local GPs volunteered to prescribe sports for their patients, but those 4 actually did it. And there were a lot of supporting activities like these booklets that help the patients and also the doctors what to do. But the key was that there were multiple sports activities for free for locals who had this prescription. So it's not just that you have the prescription, it's also that with this prescription, you can actually do something. And this activity is supported by the municipality. So why is it worth for the municipality? Just think of it. The municipality also already maintains quite a lot of sports facilities, like swimming pools and gyms and all kinds of local parks. And they would like to optimize the use of these sports facilities, which they have to spend a lot of money on anyway. Of course, as a municipality or self-government, they would like to outreach to local communities who are doing sports, and that would sort of create a connection between healthcare and between local groups. And this is a really nice service to residents. It doesn't cost much. And then this is helping the local community at a very nicely reduced healthcare costs. Now, this last bit hasn't been quantified yet, but we know from several studies, and I'm quite sure that it was also presented at this conference, that exercise medicine programs reduce overall healthcare costs. So what are the actual activities? There are quite a lot. So these are about 25 different activities that can be prescribed and that can also be received by the patients completely free of charge. Some are pure sports activities like jogging or table tennis or taekwondo, but these are also quite popular activities. Some are mild exercise like walking or these morning yoga exercises or Tai Chi exercises. So this is the type of non-strenuous exercise that can be done by a much larger population than, for example, jogging. And that's why it is already moving into the health preservation part. But some are directed to health improvement directly. For example, which is quite popular, spine exercises or spinal exercises, which are organized every day, and then they and the participants learn how to sit better, and then how to reduce their lower back pain through exercise. But also there is exercise for expecting mothers, and a few others, not too many, but a few others. But also included are a couple of health clubs, for example, cardio or weight loss clubs or stress relief programs that are not strictly exercise, but they are bundled into that. And then during the exercise, during exercise or through exercise, people can improve their cardio. And what is not on the picture, but they also organize these things, are talks and discussions. For example, the municipality invites people, experts in different fields, and then these experts hold presentations to the public about a specific topic. For example, how to start exercising if you have if you are through cardiac disease, for example. So this is the package. It's quite comprehensive, and this is going quite well for about 2 years now. This was at the local level, only one district of Budapest. But what happens at the national level? So the two programs are converging. One, the State Secretary for Active Tourism embraces these local good practices, and he includes them in the national and the nationwide program for active lifestyle. And that's why it opens new possibilities for all these local programs. That's why the local programs are also happy, because finally they got recognition, and on top of recognition, they receive support, monetary support from the health budget. So how was it possible now that after 10 years of total nihil or lack of any activity, we were able to reach some budget for these activities? And I can tell you, not because the government has more money. The government doesn't have any more money. And then this is not what they call it as a flagship program. So this is going under the radar. It's not really interesting for the government. Not because the decision makers understand this issue any better, simply because they don't. So all of the programs which were designed about 10 years ago are in their drawers, gathering dust and then not doing anything. Nobody really understands the issue better. There is not really more pressure from the public. I don't see any interest groups lobbying for exercise medicine. Nothing really is happening there. And definitely not because it has become a worldwide trend, because it is just because something is a worldwide trend, it doesn't move a government to spend money on. So the key was to find some smart money in the national budget and then reallocate this money to these programs. So where is this money? And then, okay, you can see my slides. Okay, but you have seen that before as well. I believe so. So what is this smart money? We have a very smart tax in Hungary, which is called NETA, this is the National Public Health Product Tax. This is a very complex name, but in reality, we call it CHIPS tax. This means that there is a 10% extra income tax on any food or beverage that has known health risk. For example, if you are making chips with a high salt content, and we all know that high salt content food has extra risk on, these are photos, thanks. These high salt or high sugar foods are known health risks, and then all of the companies generating income from these types of products have to pay an extra 10% into the national budget from selling these products. Now that was the input part, and what does the government spend this money on? 10% goes to health promotion campaigns. Now, health promotion campaigns were handled by the health authority, who else? But in reality, it turned out that this health authority only used 10% of this 2% of this 10% of available sum for promoting responsible pharmaceutical use. Not really a health promotion thing. And then they didn't touch the money. So that was a very strong argument from the active tourism guys that, okay, give us the money and then we make good programs for it. And one such good program can be exercise medicine, because this is really curbing the health risks or risk increase consumed by consuming unhealthy foods. And then on one hand, and on the other hand, we, the active tourism people, can do programs and reach out to a large number of people and have an effect. So this is exactly what happened. And as for the sum, we estimated that it will be about $10 million per year, which is available at right now to support exercise medicine programs. So it's not much money, but this is quite a nice sum if you would like to spend it on targeted programs, for example, like this green prescription program that I showed you before. And I believe that this can be a good practice that can be used or copied in other countries or other regions as well. So the take-home message is that, at least in Hungary, if you eat chips, you support exercise medicine. Thank you.
Thank you, Professor Sombo, for your valuable inputs. Thank you, Zambar.
I'm here and then happy to answer questions if there are any from the floor.
We are very short of the time here, so excuse us. Any question, we will mail you.
Okay, thanks.
Because now it is going to be in India, and we will send you the certificate by mail, speaker certificate. Yes, thank you. Thanks from India.
Thank you very much.
Thank you, sir. Yeah, this is a certificate which you can see on the screen being presented to you.
Thank you.
Yes. Thank you, sir. And the next speaker virtually joining us from all the way from Australia, Dr. Kierman Fairman. And the topic is a type of dose of exercise for health in cancer. And one important request to all the people sitting here, whether the speaker is online or offline, let's pay them some respect. Don't talk among yourself. Kindly pay attention to the content of the speaker, please. Thank you. Yeah, Dr. Fairman, are you there?
Yes, I'm here.
Yeah, you can just go ahead. Welcome.
You should be able to see my screen now.
Yeah, it's visible and you're audible. Please go ahead.
Perfect. So yeah, listen, I appreciate the opportunity to speak today. I hope the conference has gone well, and I would love to be there in person, but hopefully I can give you a good experience anyway and talk a little bit about what I'm passionate about, which is looking at how we can use exercise in the management of cancer. And so one of the really important parts of this area is that we've built this really strong body of evidence about the last 30 years around how and why and when exercise can be used for different cancer types during different treatments and so on and so forth. And really this talk is kind of the next frontier of that area of research where we're moving beyond general recommendations into more specific recommendations based on the type of treatment you have, the type and stage of cancer and so on and so forth. So to backtrack out of that real quickly, I'm going to give you a brief overview of generally how cancer is staged, and I'll tell you why that's important. So stage 0 is you've got a lump of cells. There's some cancerous cells. We don't really know what's going on, but we're going to get a biopsy and see what's happening. As the disease progresses, stage 1 is usually localized. So it's specific to an area, but it hasn't spread to any nearby organs. So the next part after that is stage 2 and 3. Now, this is important because this is when it starts to spread to nearby tissues. So one of the most important parts of this is how cancer spreads to other parts of the body is basically once it hits the lymph nodes. And so if you think about something like breast cancer, for example, once it hits stage 2 or 3 and it's in the lymph nodes, the risk of it spreading greatly increases. And then the risk of it metastasizing or spreading to another part of the body and forming a new tumor there increases dramatically as well. Why this is important in the exercise context is based on the stage of cancer, you'll receive a lot of different types of treatments. So for example, stage 0 or stage 1, you might only need surgery just to take care of the tumor. Whereas stage 3 and 4, where it starts to spread or it's really extensive, you might need a lot of chemotherapy and radiation and hormone therapy and all these things packaged together. And why that's important is that they all have distinct, unique, and sometimes really profound changes on the body. So again, more often than not, you're going to get one of, if not a combination of all of these: chemo, radiation, surgery, hormonal therapy, immunotherapy, and you come with all these different changes to the body, things like cardiotoxicity, damage to the structure and function of the heart. And you could have strength and function loss, bone fragility, loss in muscle. And so if you're an exercise physiologist looking at this, you already kind of intuitively know, well, the exercise that I would do to protect the heart is probably different than the exercise I would do to prevent muscle loss. And that might be different from the exercise I would do to manage symptoms of peripheral neuropathy, like balance. And so you're starting to see the first piece of the puzzle is when you're putting together your plan for someone with cancer, understanding these things is basically the first part in deciding what they're going to do and the type and dose. So the American College of Sports Medicine recognized this, and they have general guidelines for different types of cancer-related impairment, so to speak. So if you've got cancer-related fatigue versus anxiety versus lymphedema, for example, we have recommendations for different types and doses of exercise based on those trials that have been done in those different areas. But to give you more context on that, I'll go in and give you more detail on the cancer experience. So treatment for cancer can look a lot like this. So you might have surgery for an early stage cancer. Sometimes the tumor might be messy, or it might be difficult to get out real quick, or it needs to be smaller for it to be manageable. So sometimes you might get surgery before, or chemo before surgery. In other times, you might get surgery first to remove the tumor, and then you might get chemo or radiation to kind of finish off the job and take care of the rest of it. In other times, you also might get treatment before, then surgery, and then treatment after. And so here's the second piece of the puzzle. You're not just looking at what the side effects are. Now you're looking at, okay, how do I prepare the body for surgery? Do some prehab work to make sure the body's as fit as possible. Or how do I recover from surgery and then exercise during this adjuvant therapy period? So you're not just looking at the type of cancer, you're also looking at when they've gotten their treatment and looking at the schedule across time to see how we can place the exercise, because you've got to pay really close attention to things like rest and recovery, and maybe combine that with nutrition. So I talked a little bit about the different treatments. I'll just dive a little bit more into them. So surgery for cancer is more often than not used to remove the tumor, but it can also have curative intent, or it could be diagnostic in nature, but it also could be restorative. So restorative could be where someone gets half of their breast removed, and maybe there's some muscle taken with it. So they need to take muscle from the abdominal wall, or maybe the latissimus muscle to replace that chest wall. And so if you've got surgery in those areas, not only are you waiting for the scar tissue and the range of motion around that joint to heal, you're also restoring the function of where you've removed the tissue from. So if you took tissue from your abdominal wall, your core is going to be weaker. There's also all the other typical things that you would expect from surgery intuitively. with the exception of things like lymphedema. So lymphedema is a swelling of the extremities. More often than not happens with breast cancer, but certainly people with ovarian and gynecological cancers can be at risk of this for the lower body. But it can be an extreme swelling of the limbs. And so we have to be very careful in managing lymphedema and making sure we don't cause excess fluid buildup or anything like that. Likewise, dyspnea or shortness of breath is common in lung cancer. If you've got surgery to remove some or part of your lung, your ability to take deep breaths are going to be impacted. So when we're thinking about exercise, oftentimes we split up the exercise and do more interval-based work to allow for bursts of exercise, but allow people to recover and catch their breath. And so again, you're starting to look at, okay, what is the cancer they had? What is the treatment they had? Radiation is very common. So this is an example of someone getting radiation for head or neck cancer. And it's typically given to kill cancer cells and damage DNA. This is difficult to do. And so what that means is people usually get radiation 5 days a week for 4 to 6 weeks at a time. And so even when you're thinking about exercise, then you're trying to worry about how do we combat the fatigue of radiation and make sure people are still able to exercise. So it becomes less about the type of exercise and more about forming habits and the behavioral aspect of exercise. So building in flexibility to what they can do allows them for more confidence in their ability to make sure they can do it and stay active throughout their treatments. And here's a list of changes from radiation as well. Some of the more common ones, as I said, fatigue is very, very common in radiation, as are skin changes. I mean, if you've had sunburn before, this is 10, 15 times worse. The worst sunburn you could ever imagine. And that's kind of a localized feeling. So you also have to manage the pain that comes with it as well. So you have to be very careful in coming up with exercises that are manageable for them to do around their pain and tiredness. And again, centered in behavioral theory so that they can stay active as well. Contrast to that, chemotherapy is used to kill rapidly dividing cells. So typically, people, it's changing now, but more often not, people get an infusion. So they sit in a chair like this and they get chemo. And it's not just one type of chemo, there's hundreds of different types of chemotherapies. And they might get one or more chemotherapies flushed throughout the body. And that's used to kill rapidly dividing cells. So usually trying to kill, slower, or reduce the growth of the tumor. One of the important things, as I said, usually people get some sort of infusion or oral administration. And it happens over years as they're going through their treatment. And then chemotherapy is really toxic to the body. And so what happens is your body is trying to metabolize and clear all this treatment. It's really difficult. So they need some rest after that time period before they get another chemotherapy infusion. And so that period of an infusion followed by rest is called a cycle. So you can have a cycle of chemo is your infusion plus rest. And then you'll get multiple cycles across a month, again, depending on the type of cancer, the stage of cancer. That will dictate what type of chemotherapy agents you get and the combination of those and how they're put back to back. And then how many cycles you'll get across time in addition to how you're responding to it. And so this is really important for a few reasons. One is the body changes across cycles. So this is an example of immune function changes as a consequence of chemotherapy. So you'll see here, we got blood counts before chemotherapy and then track blood counts all the way through each cycle. So this is in breast cancer. Imagine these cycles are about a month apart. So you're looking at monthly changes in blood counts across time. So this is an example of hemoglobin, and you can assume that white blood cells follow the same pattern. And so what's really important here, hemoglobin especially, we know it's the oxygen carrying molecule. If you're anemic, your fatigue is going to be really high. Likewise, if your red blood cell count is shot, your ability to respond to infections is going to be really poor. So what happens there is a common cold turns into pneumonia and you're hospitalized for a few weeks. And so when you're working out or exercising during chemotherapy, we have to be really careful about not stressing the body too much, about making sure people are in a safe place to exercise and managing the changes in fatigue that come with these, the changes in blood counts. You also have a huge risk. Huge is a bit overstated. You've got a large risk of cardiotoxicity, meaning disruption to the structure and function of the heart. Usually is a consequence of change in LVEF, left ventricular ejection fraction. So that's a sign that your heart isn't pumping out as much blood as possible. And that's usually a consequence of different types of treatment. So again, anthracycline-based chemo is different than trastuzumab, but they will have similar risks on cardiotoxicity. Or immune checkpoint inhibitors can also increase the risk of cardiotoxicity. So what we do, again, when you're putting this puzzle together, you're saying, okay, they've got this type of cancer and they've got this type of treatment. Now, if they're getting anthracyclines, we know that the risk of cardiotoxicity is high. So maybe you want to have more cardiovascular training in there to protect against this damage to the cardiovascular system. This is a really important graph for a few different reasons. So this is depicting the cycles of chemo. So we know that physical and psychological distress fluctuates throughout course of time. And what that means is when you're getting, say you're getting a cycle of chemotherapy here, your physical side effects, your nausea, fatigue, inability to sleep, your stress, all of those peak, in the days or weeks following it. And then what happens you slowly come down back to normal, and then you get another infusion and it spikes again. And generally, the side effects compound over time so that on your 5th or 6th cycle, you typically feel the worst. And what that means is when your physical and psychological distress is at its highest, your ability, your desire to take part or respond to an exercise session is going to be at its lowest. And so we have to deal with these massive fluctuations in psychological and physical readiness to train. And what that means is we have to have a tremendous flexibility in how we deliver exercise. And again, incorporating the behavioral aspect of ensuring that there's habitual routine instead of like, what's the best type of exercise to do whatever. So we're trying to pay attention to these patterns. And the unfortunate thing is that those patterns aren't necessarily predictable. So a lot of the times you're doing it in real time. One of the really important outcomes in working with chemotherapy is this relative dose intensity. So relative dose intensity means what is the percentage of treatment I got relative to what you said I could get. And so what happens with chemotherapy is oftentimes people get sick and they can't handle that dose of exercise. And so, the dose of treatment. And so what happens is you either reduce the dose that you're giving them, or you might delay their treatment. So instead of coming back every 3 weeks, they come back 5 weeks later. And so we know that if your RDI isn't sufficiently high, if you're below about 80% of what we want you to get as far as chemotherapy, your chance of survival is much lower. And so there's a few theories going on here, but one of them is that if you exercise during chemotherapy, especially cardiovascular exercise, there might be a way to influence this RDI and show increase the tolerability to chemotherapy and potentially have benefit there. So that's ongoing work that people are trying to explore, but now we're looking at what type and dose of exercise might be beneficial in RDI as well. You've also got corticosteroids. So these are very common given with chemotherapy to reduce allergic reactions or reduce nausea and stuff like that. The problem with corticosteroids is weight gain is probably the most common side effect. And typically in things like breast cancer, it can be very hard to shift that weight gain. Particularly when you combine that with hormonal therapy in breast cancer, oftentimes that puts people into menopausal status. So now you've got 30, 40-year-old menopausal women who have gained 30, 40, 50 pounds and trying to lose that again after treatment. So then the exercise for them is more about making sure their body is strong and healthy and they can retain or maintain a lot of their lean mass or muscle while they're losing weight. So maybe you have more of a resistance training focus. I talked a little bit about hormone therapy. So hormone therapy, especially for prostate cancer, hormone therapy in prostate cancer, testosterone is a key driver of prostate cancer growth. So what happens is to try and remove the tumor, you basically stop the production or the action of testosterone. So hormone therapy is basically castrate therapy. You take testosterone completely out of a man's body, and then what you see is these really remarkable changes in losing muscle mass, in gaining fat mass, in losing bone mineral density or bone health, and losing strength and function as well. So we see these changes that are fairly rapid. They onset in around 2 to 3 months, and then they get more pronounced as people move on, where you're looking at 6 to 10 pounds of muscle loss across a half a year. The other interesting thing about cancer is that a lot of times people survive the disease, in the sense of the treatment might work in putting you into remission, but unfortunately you're left with the long-term consequence of the treatment. So we know that the changes that happen from hormone therapy in prostate cancer dramatically increase the risk of diabetes and cardiovascular disease in prostate cancer. And so then if you're working with someone after their treatment has ended, you're looking to combine nutrition with exercise to try and manage their diabetes, or try to maybe have a bit of a cardiovascular emphasis to slow the risk of cardiovascular disease. And then there's a lot of other side effects. And the only reason I'm showing you this is because not all hormone therapies are the same. Some therapies have different mechanisms of action, but even the list alone, as far as what the side effects they will experience, that's going into the equation of what we're trying to do. Is we're thinking about what is the cancer, and what is the stage of the disease, what treatments are they getting, what are the side effects, and are those side effects reversible with exercise? And then based on all that, you're putting together this package of how and what makes sense from a physiological perspective and psychological to put together their exercise plan. Hormone therapy for breast cancer is similar. So we know a large majority of breast cancers are estrogen receptor positive, meaning they're influenced by estrogen. So the goal of hormone therapy in this case is to block or stop that estrogen. So selective estrogen receptor modulators, tamoxifen is a very common you will hear, is given for up to 5 years after treatment. So chemotherapy is finished, and we know that it's responsive, the tumor is responsive to estrogen. So tamoxifen will block the receptor so estrogen can't get in and the cancer can't grow. When you're in postmenopause, the only way postmenopausal women lose the ability to produce estrogen with their ovaries. So in postmenopausal women, the main site of estrogen, the main way we get estrogen, is through its conversion from testosterone using aromatase. So aromatase inhibitors are given to postmenopausal women to block aromatase and again stop the production of estrogen. So again, it reduces the risk of breast cancer. Same thing, given a tablet a day for up to 5 years. In these cases, joint pain is really pronounced. It's one of the most common side effects of hormone therapy in breast cancer. And so a lot of times when we're talking about the dose of exercise or the intensity of exercise, we have something that we might be planning to do. Maybe it's some strength training and squats and things like that, but we let pain be our guide. So we'll have intensity scales of which we manage or work around joint pain, or there are specific movements or the specific range of motion that influences joint pain. So then we scale it back and go off pain as well. So one of the most important ways that we try to put all this together is thinking about this. So cancer treatments have all these different types and dosing schedules. We're trying to see how all they fit together and understanding the side effects, and then backtracking to basically put that puzzle together for our exercise program. The other thing I mentioned is the idea of timing. So we have this framework that basically tells us, here's how and when you exercise. So before treatment, the goal is prehabilitation. The goal is to get your body as fit as possible. Again, trying to think about if it's lung cancer or breast cancer receiving anthracyclines, we might want to do a lot of cardiovascular training in this period to prep the cardiovascular system. or if it's prostate cancer receiving hormone therapy, might want to do a lot of resistance training to prepare the body and muscles for that treatment. During treatment, the goal is to just stay the same. We know that the changes from treatment are so pronounced that if we can keep you fit throughout your treatment, that's a huge win. And that's important because people can be getting treatment for like 6 months at a time. So if you can go to the gym 3 days a week for 6 months and we can keep you at a sweet spot, well, then that's the jackpot. And then after it, we're just looking at overall health promotion. How can we manage the long-term side effects of the treatment, but also have a view to the future with trying to manage upcoming side effects or reduce the risk of recurrence. And then importantly, not everyone survives cancer. So a lot of times we move into this palliative stage, and the goal there is to just give people a full life. How can we keep you out of bed as long as possible? How can we keep you on your feet as long as possible so that the end of your life is as enjoyable as possible? So this framework kind of allows us to pick, again, on top of the treatments, on top of the stage of disease and the type of cancer. Now we have an idea of how and when we plug in our exercise and how that might be different based on those goals. And here's the other contrast. So everyone wants to know what's the best type of exercise. Well, look at this. We have a 30-year-old who had breast cancer and used to be an athlete. And all her treatment was early stage breast cancer. She had surgery and she was active before. Well, she can, aside from recovering the surgery, she can do whatever she wants. She's pretty good. She's good to go. Compare that to someone who would represent what we typically think of as like the standard, which would be stage 3 cancer, undergoing chemo, former smoker and is diabetic, never active before. So you have to think about, well, what chemo is she receiving? If she's a former smoker, she may not be fit. So we have to worry about that. And on top of being a diabetic, we have to worry about glucose changes with exercise. And so starting exercise during chemotherapy is also going to be completely challenging for someone who's never exercised before. So the type of exercise and how we frame that for her will be completely different. And then we've got the other end of the scale where we've got close to a 90-year-old metastatic pancreatic cancer, who's bedridden, end of life, and has a mental disability. So again, the type of exercise that we think would be good theoretically may not necessarily work for this person. And all of 3 of these people fall under the umbrella of having cancer. So it's hard to say this is the best and this is the type of exercise because there's so much variability. And so this is the puzzle that we're coming up with. My goal today is not to tell you what the best type of exercise to do is. My goal is to share how we think in the field of exercise oncology and how we put together the puzzle and think critically about how and what can I use from exercise perspective to manage this. And so here's what we look at. We say, okay, what type of cancer do they have? What stage is it? And has it metastasized? Has it gone to other organs? Importantly, has it metastasized to the bones? Because if it metastasized to the bones, then we got to be worried about bone pain and risk of fractures and things like that. Where are they along the cancer continuum? Are they in that prehab stage? Are we trying to buffer some of the side effects of treatments? Are they during active treatment and we got to manage the side effects such as nausea and fatigue and sleep changes? Or are they after treatment where the immediate side effects might have gone away, but they're starting to deal with some of the late and long-term side effects? And then importantly, the treatment. What's the type of treatment they're getting? What's the dose? So we know that anthracycline chemotherapy are really cardiotoxic, especially at high doses or given a long time. Whereas platinum-based chemotherapies, like cisplatin, have a high risk of peripheral neuropathy. So the type of chemotherapy can have different side effects, and the dose of chemo and the combination and duration as well. Along with their psychology. And this isn't just trait psychology. So as an individual, are they inherently, what's their motivation level? What's their confidence in their ability to do tasks, exercise in particular? What is their trait level of depression? On top of their state and psychological well-being, meaning how are they responding to their cancer diagnosis and the treatment and the stress of all that? And how does that influence all these things that we need to be careful with putting additional stressors on them with exercise? And then all the other things you would typically think of in terms of working with anyone in life in general, looking at their physical limitations. What's their training history? Have they done exercise before? Do they have any injuries? What's their range of motion? Do they have comorbidities? You can have people with cancer and COPD and NEOA and diabetes. And so that becomes a bit of a puzzle to figure out as well. And then do they have another cancer? Has it recurred? Do they have a secondary cancer? There's times where people can be going through that continuum, and while they're receiving chemotherapy for one, receiving another diagnosis, and that brings its own challenges. And so this is ultimately what we try to do. It's a really challenging field. It's a really rewarding field, but you're never going to find this is the type and dose of exercise that can work for all people with cancer. It's taking all these things together and then coming up with your own program based on the physiological principles of training and behavioral theory, combined with your knowledge of the side effects of treatments and so on and so forth. And hopefully we can improve people's strength, function, and the most important thing is their quality of life. So I really appreciate your time. The summary is essentially that there is no one size fits all. There's no best type of exercise. How you decide what the best type of exercise is understanding all those things, the type of treatments, the stage of disease, when do you intervene, using behavioral aspects to help people. And with that, I appreciate your time. I'll just check the chat. I don't know if there's some questions here. No.
Thank you very much, Chairman.
No problem.
Lecture on the cancer. We miss you in India.
Yes,
And-
I would love to be there.
Yes. And we are going to honor you with certificate. And we will send you by mail. This is your certificate. All of you clap, please.
Brilliant. Thank you so much. Enjoy the rest of the conference.
Thank you very much. Then
Bye-bye.
one of the physical session, last upset session of the participant, Dr. Ankita Jain. She is a sports psychologist. And I request Convening Singh साहब जरा ऊपर आके बैठो, नीरज जैन साहब आपके थोड़ा लास्ट सेशन है, आप मैं थोड़ा engagement रहेंगे. And Mama Shiva is left out from Malaysia. We'll see if he come online. We will have. Please have patience for another half an hour. Everything will be finished. Come on, Lynn. Oh.
So good evening or good afternoon? Ma'am, just finished the lecture. I think that's all I can hear in your voice. Are we ready to listen for another 15-20 minutes? Or waiting to run away? Run away, no? But this is going to be something you all will like hearing about. You all have mobile phones? Who all have mobile phones? Take out mobile phones. Take out your mobile. Only one person has mobile phone in this hall. Do you all play games on your mobile phone? Yes? How many people? 1, 2, 3, 4, 5, 6. Others don't play mobile games? Okay, so then that means I have to also explain the topic to you. All right. Can we have this light off? नहीं तो वो दिखेगा. ये वाली दो light off कर. Thank you. So, all right. Before I could introduce myself, they decided आप चुप हो जाओ. All right. So my name is Ankita Jain. Can I have the other mic also? Does this work?
Yes.
Hello? Hello? Yeah. So this works. My name is Ankita Jain. I'm a sports and counseling psychologist. I'm also a physical literacy advocate. So me and Amit Manu, we used to work across India trying to make sure that our generation is healthier and more active. This is what I heard from Dr. Kiran Khanna. This is what we've been talking for the last 3 days. How to make sure we have programs and policies in place that we can make our country, despite the age group, young, old, geriatric, more fitter, more active, right? So now a specific population that I work with, and I think was being ignored, is the gaming population. And this can be a friend, this can be a neighbor, this can be a classmate, this can be a man who's addicted to Candy Crush. Right? So how many of our mothers are playing Candy Crush or our parents are playing Candy Crush? My mom is addicted to Candy Crush. Right? So at night, if I tell her go to sleep, she'll say, no, I need to play for 2-3 hours and then I can relax. So from our parents, grandparents, or our friend who might be a gaming addict or who might be a upcoming athlete. So the reason we're discussing this in exercise medicine is because this is a new profession, this is an upcoming niche, and this is also a possible career for all of you who are in physical education and sports science. Right? Before I go ahead, I really want to thank Professor Lee for encouraging me to do this work. Emma, have been talking about this. I have spoken this week at Dr. Rajesh also. But I think I wouldn't have the courage to present without Dr. Lee. So thank you so much. All right. So, 2 things that we want to make sure, we want to understand why exercise for gamers and how can we incorporate exercise for a gamer's life, right? So, 2 topics that we're going to go through the next 15 minutes is importance of physical activity for gamers. Why is this relevant? When is this relevant? How is this relevant? Resistance from movement in electronic sports. That means that if I am a gamer and I want to sit on my console or with my mobile phone for the next 12 to 14 hours, you know that if I want to be a sports person in online gaming, I have to be a minimum of 14 to 16 hours every day. And this may include my sleep, eat, and the streaming time. So that means all of them are online minimum 20 hours a day. So let's physical movement important. And do I have time for physical movement? It's a big question here. And then process of change and motivation enhancement. So you will remember this lecture from day 1 when Professor Gary Kwan was talking about this. That when people need to move, but they don't have any motivation to know, how do I get them to move? Right? Now, why are we talking about gaming behavior? Because right now, WHO says that gaming is actually becoming a disorder. So it's not fun anymore. As soon as competitive gaming started coming, there were people who were taking it as profession. But almost few land up making money out of it. The rest are also getting addicted to it. And gaming disorder or gaming addiction in the last life is not just about your normal Minecraft, Candy Crush, League of Legends, World of Warcraft. It's also about fantasy sports. So all of us know Day-11. Yeah. So cricket betting, casino betting, all the gaming addictions are happening, which means people are losing money. People are losing their sleep. People are becoming more sedentary and more psychosocial issues are also happening. So that's why India is raising a huge concern. In fact, the government of India now mandates the gaming industry to have a regulatory body which will make sure there is somebody from physical education, somebody from child education, somebody from psychology, somebody from Ministry of Health, nothing after gaming education. So this is a great career for our crew in the future. That's why we're pushing this topic in our platform. Right? So we have been talking about gamers' physical health and mental health repeatedly and saying that we need to exercise. We need to make sure gamers are exercising. But is this such a huge number? If there are just 5,000 gamers in maybe my neighborhood, maybe it doesn't matter. But if I look at statistics, the gaming industry right now, $180 billion. Money, how much? What maths of the some snack around, maybe 1,000 crore? 1,000 crore? That's been earned by gaming industry. 1,000 crore has been earned between gamers. इंडिया में 2 करोड़ गेमर्स है अभी so if 2 crore gamers, how many of them are exercising? How many of them are fit? You can have to look at the list. There are the three, only 11% have a laptop. Right? Everybody is playing on the mobile. And if I say everybody, we can have this health issue only for the work, 18 to 24. Because they are playing more than 5 times a week. No. This health issue, but I also think people our age, all the people in the first 3 rows, we are also in this health issue. Because they are also in our mobile all the time. So imagine so much of population that we have to take care of. Right? So, what is the future of the country? Are we going to have health issue, NCD, back pain, like Professor Lee was saying? Are we going to have that? Or are we going to take care of our youth and our elder population? Or are we just going to increase the disease and burden? So, I have an experiment for you. Just to understand what I just said, take out your mobile, everybody. Take out your mobile. Everybody, take out your mobile. Okay, in the next 1 minute, you're going to try it. In the next 1 minute, you have to try it. Create a word. That means you're using both your fingers. So That's total interaction. So just sitting alone every day. Imagine what one life will be. 4 hours you don't get out of the back room. You're sitting alone, you have no real friends. You know? That training, which means that's when you are learning to become now, whatever environment, not only interacting with the counselor, but doing the thing of the treatment, which means whatever kind of movements are happening. Right? Compare around the rest. Maths and math were generated from the standard CPUs that they using. So maths action is what they're taking in continuously. And maybe air conditioner run with no pressure. So continuous accessible going in, they have natural amount of the living in. So what's really happening outside, that are naturally socially not happen. And a lot of games require them to be more competitive and aggressive. Unless they will be like angry, agitated, they will be angry time, because that is the personality that is needed. So, absolutely. So, when we last time, 1 second, the next significant is that my parameter also. Because lack of physical activity means power of body is decomposing, muscular dystrophy, you're not using the body happens properly, you're not waking on time, you're not sleeping on time. And instead of increasing obesity, cardiovascular problems are being reported, musculoskeletal disorders are being reported, sleep disturbances are being reported, and mind this is stopping the 16-year-old, 20-year-olds who are giving this complaint. But physical health, overall decreased physical fitness, mental health, depression, anxiety, low self-esteem is being reported. Posture issues are happening, but back pain, severe shoulder pain, neck pains are being reported. And that's also is one of the major complaints of the family. So, the thing that Dr. Lim, Dr. Smith in the morning is one of the important areas that have been highlighted and can be reported in government the morning. And this is just to add to the whole idea of how severe the issue is. So, repetitive strain injury, 36%. Fracture color, 1% of the humors. And total vision syndrome, 39%. Neck and back pain, 45%. Obesity, 22%. Mental health issues, 9% of the humors, which I find very new. I'm sure it's higher than this. 56% other injuries reported, and ergonomic issues, most of them, because ergonomic chair, that fancy chair I just showed you, that costs 25,000 minimum. So not everybody is buying this, and they're playing on their mobile. Not cognitive performance is going down, because our way is sitting and focusing on one screen, on one small mobile. The emergent stamina is going down because we're not getting enough moving. So that means there's a lot of area that all of us can work on. So like for any other athlete, I think for women also, they need to start focusing on physical activity. Now I want to ask you, if I were a gamer, will I take care for my well-being? And you develop a program for my well-being. So let's look at it. My lifestyle can be balanced. If I remember, I'm not 14 to 16 hours a day. So my program has to make sure that we get something better related, but I can do a short burst of time. Right? I know there are a lot of parents in gaming community who are talking about physical fitness, but they are only suggesting it. There is no concrete related program. So this is a shared back area. Physical health is improving, mental health will improve, women performance will improve, endurance will improve, if some good program can get back to this community. Today, longevity, but entrepreneurial retirement age can be solved if something can be brought to this community. So type of exercises can be many, we have to keep thinking of aerobic and my strength training and my leader training. There's just so much that we can do for them. But right now, nothing is happening. But the question is, how will we motivate them to exercise? But exercise is important to them because they also think that health is not a sport. They also think they are not an athlete. They just have a different way now, neither a real fitness. So if they can change their attitude, they can motivate them. So creating the process of change will only happen if we start believing that humans need us. And they have announced the last prize that I have is just an example in case you're developing a program where these engage the humans, not in dynamics that I have worked with everywhere in the gaming team. So when your manager wants to do any fitness exercise, there are ramifications. There is motivation in terms of competition between them to make them exercise. So what game dynamics are what scale also wants to flow. Okay, so the next slide will be see that there are other things that gamers like. So fantasy clubs like times and many competitions and levels and but there are other things in gamification that can learn from a gamer mindset to build an exercise program for them. Anyway, so but now the end of the presentation, saying that the steps you can use to build your motivation enhancement and exercise